My name is Andrea Hersberg, and I'm the Ovarian Helpline Coordinator at SHARE. Before the presentation begins, I'd like to tell you about SHARE. SHARE is an amazing 37-year-old nonprofit, and we help women and caregivers face breast or ovarian cancer by offering the unique support of survivors who've been there. Our services are all free of charge and include telephone helplines, in-person and telephone support groups, educational webinars like the one you are participating in right at this very moment, and public health initiatives. For more information, please feel free to visit our website at www.sharecancersupport.org or call 844-ASK-SHARE. Now I'd like to tell you about the format of this program and how you can participate. All participants are muted so that we can clearly hear the presenter. If you have a question during or after the presentation, please submit the question through the question panel pane in your control panel. You can access the question pane by clicking on the red arrow in the upper right-hand corner of the screen. Once the presentation is over, we'll open it up for questions. My colleague, Savannah Stein, SHARE's Ovarian Program Director, will field the questions and read them to the presenter. Now, it is my pleasure to introduce Dr. Mindy Greenstein. Dr. Greenstein is a cancer psychologist and consultant to the Psychiatry Department at Memorial Sloan-Kettering Cancer Center, and she herself is a two-time breast cancer patient.
Thank you very much. Thanks for inviting me, and thanks everyone who braved the Arctic tundra, that's our city, and everybody calling in. So the title of the talk is Coping with Cancer. If Cancer is a Gift, What's the Return Policy? So that probably gives you a little bit of a hint to who I am, but I will tell you a lot more as we go along. One of my favorite movie scenes, I should say, that really stayed with me and really came up a lot after I started dealing with cancer myself was a scene from Annie Hall, where 9-year-old Albie Singer is depressed. And his mother takes him to the doctor, and the reason he's depressed is because he was reading in a book that the world is always expanding. And if the world is always expanding, that means at some point it's going to blow apart and we're all going to die. At which point his mother smacks him upside the head and said, "What's that your business? He won't do his homework." And I really thought that's sort of the dilemma of the cancer survivor. And it doesn't matter what point you're in. You might be newly diagnosed or in treatment, post-treatment, dealing with metastatic issues, is how do we live in the face of our mortality? The clock is ticking for everybody, but once you've dealt with cancer, the clock ticks more loudly. And it's a kind of ironic that for something like mortality, which is something that we share with literally every other person who ever existed, and yet when you're dealing with it yourself in your personal life, it can feel very So I want to talk about the experience both from my clinical and personal perspectives. And one thing that was sort of funny about when I started to work at Memorial, we call it Memorial, most people call it Sloan-Kettering, was that when I was young, I'm from Eastern European Jewish descent. And people of Eastern European Jewish descent are very comfortable talking about medical problems. They love talking about their intestines and their pancreas and anything that comes up. But there was one illness when I was growing up that was not okay to talk about, and that was cancer, which had to be spoken only in a whisper, unless sometimes my parents would refer to it by the hospital that they knew treated it, and that was Sloan-Kettering. But because of my father's accent, he pronounced it like Sloan-Catering. And so I had these images of sort of the bar mitzvahs of my youth, and somebody with sort of these double spoons ladling out the chemo from the sterno-heated trays. And then I started to work there, and I couldn't shake that image. And then I became a patient there, and I still couldn't shake that image, and it always gave me a laugh. And I thought I bet the word Sloan-Kettering don't bring up a lot of laughs normally, but I really like the fact that the name made me laugh. So just in terms of my own stuff. I was diagnosed with stage 2 breast cancer in 2006, and I was at the time 43, and I had 2 sons who were then aged 10 and 5. I had a recurrence in 2011, and since then, so far so good. As my mother would say, knock on wood, poo, poo, poo. One thing that was particularly interesting to me, I should just explain that at the time I was diagnosed in '06, I wasn't seeing patients at the time. I took some time off in 2001 when I had my second son to both raise my kids, and also I was working on a book about how people cope with crisis. My parents are Holocaust refugees, and before I worked in cancer, I was a prison psychologist in the Federal Bureau of Prisons. So I was working on a book about sort of general ways that people cope with crisis, so I wasn't seeing patients at the time. And yet, one of the things that was so shocking to me when I got diagnosed was the very fact that it was so shocking to me, and that I felt like I was a civilian like everybody else, and I didn't have any special techniques for helping myself through it. I had a very hard time. I was crying a lot, very anxious, and I was a little irritated. I kind of felt that I should have not had to start from scratch, and yet that's what I did. I think cancer has a special place in our cultural imagination for a few reasons. It's experienced somewhat differently than other illnesses. Most illnesses are really experienced as sort of defects, problems. A husband and wife, where the wife had breast cancer and the husband had heart disease, he described his illness as trouble with the pipes. Just something just didn't work right. She experienced her illness as a betrayal, as almost as if it had a personality. And that was part of her, the way that she experienced it, and I think a lot of people do sort of experience it that way as well. And in addition, cancer is one area where the treatment is just as scary as the illness, and for some people it's more scary. And a lot of the images that we see of cancer are often the images of treatment, in particular, hair and various, body parts. So we aren't just the sort of warriors on the front line. We're also the battlefield itself. If the good guys or the bad guys are throwing the bombs, they still sort of land on us. And when the doctors do what they do in order to help us get rid of these cancers, we don't particularly like the things that they do to us either, and we have to deal with them as well. And in addition, life is sort of uncertain. That's kind of the nature of the way life works. But cancer really heightens that sense. So many questions. What's the treatment going to be like? And what are the side effects going to be like? And what's the future going to be like? And I think of it as sort of the two battles that we fight kind of simultaneously. And the first one is the medical battle, which is, sort of the famous one. But the second one is a battle that actually is true for anyone in life, but it's sort of particularly heightened in cancer, which is the desire to have a meaningful life with joyful moments, no matter what's going on with that first battle. And that's really sort of what I'm really talking about. And one thing that's really important to remember, and this is being a little fidgety, so let's, you know what? The little trick's not working. Oh, there we go. Okay. One thing that's particularly important, kind of no matter what I say here, is that there's no one-size-fits-all model when it comes to coping. And it's very important to say that, I think, because a lot of times people dealing with cancer get lots of sort of feedback from other people that seem to suggest they might be doing it the wrong way, that they should be doing it a different way. And really, it's our job to always sort of figure out what our way is. And it's basically a pragmatic issue. It's what makes you feel better and what makes you feel worse. And you may get a sense of what makes you feel better from your previous life, from before cancer entered. Cancer is not usually, by the time you get to adulthood, it's probably not the first crisis you've faced. It may be the hardest and it may be the most in your face, but there have been times along the way when you've had to deal with something. So one thing that's useful to do is to try to think back on, well, what kinds of things made it go better? What kinds of things helped you deal with those crises, and might they feel better again? What things made you feel worse? And these could be attitudes or behaviors or activities or people you hung around with. And sort of getting a hint for what worked before might help with what works now. For me personally, I knew that I need a feeling of control, and one of the ways that I get that control is by getting as much information as possible. I have friends and I've had patients who are just the opposite. They want as little information as possible, just enough to make informed decisions. So it's useful to kind of figure out where you are. For me, I go right to imagining the worst. So information is actually helpful to me because it's often less horrible than what I'm imagining. So what makes you feel better? And sometimes that's really just sort of trial and error. The way you find out what makes you feel better is by trying things and they don't work. That can be painful because they don't work. But then you kind of feel along the way and find out. So I'm going to sort of use my story as a jumping off point, because I actually found one of the things I found most helpful when I was going through it was hearing other people's stories. And also, one of the things that does, it creates sort of a context for their advice, and you can sort of get a sense that, well, maybe I'm like this person in this particular way, or I'm not like this person in a particular way. And sometimes they're helpful in sort of surprising ways. So the person who was actually most helpful to me when it came to decision making was a woman who, I have a hard time with decisions. I always think about the one hand and the other hand and the other hand. But she was sort of a, very emphatic gal, and I would tell her my pros and cons, and she'd say, well, it's obvious to me what you want to do is X. And I would have a very strong emotional reaction right away, and it would either be, yes, she's right, or that 80% of the time it was, no, that's not what I want to do the other thing. And that was helpful to me, even in the negative, which also made me think of kind of a piece of advice I give people, which is if you're having a hard time deciding on something, go to someone you rarely agree with, and then you just do the opposite of what they say. So to give you a sense of where I come from, mentally, one of my favorite jokes came from an old book of Jewish jokes, and this one was an example of a Jewish telegram, which was, start worrying, details to follow, which I always felt really, it sounded right for a lot of Jewish history, that start worrying, details to follow seemed reasonable. And I personally grew up with what I think of as an ayin hara personality, and what that is, for anyone who's not familiar with it, is the Jewish version of the evil eye. And what the teachers would teach us was never say something good is going to happen, because if you do, the evil eye will hear you and make sure it doesn't happen. But also, don't ever say something bad is going to happen, because the evil eye will hear you and make sure it happens. And so the message to me was, well, you're screwed if you think a good thing's going to happen, and you're screwed if you think a bad thing's going to happen. So basically, you're just screwed. And I come by this attitude honestly. I remember one time my husband got a promotion and a raise at work, and my father said, oh, you're going to have to pay more in taxes now. So, but the fact is, even someone like me can end up coping. And I think that's sort of useful information to know. And in fact, the first model for coping that I had was my father. When I was very little, his appendix burst, and he was in the hospital, and nobody expected him to make it. And in fact, a nurse incorrectly told my mother he had died in the night, and it says, "Oops, sorry, I made a mistake." But they actually, they didn't think he was going to make it, and he just celebrated his 93rd birthday a couple of months ago. But what he used to tell us, and sort of the family, mythos, was, I kept focusing on you and your brother. My brother was an infant at the time, and bar mitzvahs I wanted to go to, and weddings I wanted to go to, and I just focused on that, and that, that kept me going. So I thought, okay, that approach worked for Dad. it'll work for me. And so I would do the same thing. I would look at my kids kind of from the side so it didn't look too creepy to them. But instead of having this sort of surge of strength from it, I would start to tear up. I'd become extremely aware of what I had to lose. I'd have to leave the room, and I would go sob into a pillow. And I would do this again and again. And after about the zillionth time that I was sobbing in the pillow, I realized, I think this approach may not be working so well for you. But I really didn't know what I was going to do. I really didn't know what approach would work for me. The one thing that I knew from my early pre-cancer life was that I liked television. So I watched lots and lots of television. And that was helpful, but there's only so much even good television can do. So there was one day when I was crying on my red living room rug, which I also don't like. My husband picked the red living room rug, and I never particularly liked it. And I had this memory of a patient that I had seen back in, when I was in training. And she was a woman who had a gastrointestinal cancer, and she had just recently been diagnosed. She was in the hospital waiting for surgery, and she had to be taken off all foods and liquids beforehand. But in addition to dealing with cancer, she also had schizophrenia. And she had been on a very good cocktail of medications that had been working very, very well for her for about 2 or 3 decades, 20, 30 years. She'd been doing fabulously well, living in a group home, but they had to be stopped suddenly also while she waited for her treatment, her surgery. So they asked me to see her for 2 reasons: make sure that she understood what was going on, and also to help her cope. She's going to have a lot to cope with. And so I met with her, and in fact her psychotic symptoms were really back in droves. She had lots of sort of delusions about murders taking place. She had auditory hallucinations, voices in her head, and yet she was utterly serene and calm when I met with her. She understood all that was going on as well. So I was asking her about all these kind of added stresses that were going on, and I was asking her about the hallucinations, and they were the voices of Jesus, Moses, and Satan in her head, and they were with her throughout the day. And I asked how that was for her, and she said, well, Jesus and Moses say very nice things to me, so it's actually pleasant. And I said, I noticed you didn't tell me what Satan said to you. And she said, oh, he says such terrible things I just can't even tell you about them. And I said, well, how did that feel? And she looked at me in a very maternal way, and she said, oh, him? I don't pay him no mind. And she just, flipped her hand like that. And that was it. This is the way I met with her daily, and she was doing well. Her attitude never changed, and she just ignored, the demons in her head. She used the ones that were helpful. She ignored the ones that were not. And even at the time, I remember thinking, she didn't even need me at all. She didn't even need to admit me. But thinking about her at this moment, while I was crying on my living room rug, it really just sort of stopped my tears in their tracks. And thinking about her made me feel like with all that she was dealing with, she was able to literally ignore the demons in her head. I suddenly had the faith that I will find my way too. I didn't know what that way would be, but just the fact that I had the faith that I would find my way, that took the edge off, and I immediately felt better. And it just so happened that this had an added effect. I remembered that moment when I thought she never really even needed to see me, and I felt like, well, you know what? I needed to have met her. This was a very important thing that helped me in a way I never would have expected. And the other thing that came up in my mind was that book I mentioned that I have been working on. I needed what was thought of as a cohesive narrative arc, a storyline. And suddenly I thought, oh, I think I have a storyline. The psycho-oncologist who got cancer and is helped by her patients, the memory of her patients. And this added thing actually sort of really transformed my cancer experience and made me experience it as something that had a new meaning, had a new purpose. I was going to use all this, what I thought of as catastrophic stuff, was now material. It was now material for a book. It was now the furtherance of my psycho-oncology education, and I will make use of it. And I want to help people through making use of it the way other people were helping me. So what happened was I ended up coming up with sort of the positive aspects of my cancer. I still felt my cancer sucked on the whole, and there's no way around it. But there really were some positive things that came of the experience, especially in this sort of transformed way for me. But the first thing was, and I hear this from a lot of people, a new appreciation of the people in my life. You know, the people who take care of you, the people who want so much for you, and the people you need to take care of. They have a special meaning now. I remember one time when I was putting my son to bed, and every night we did a little nose kiss. And as I was putting him to bed and we did the nose kiss, I said to myself, I love this nose kiss. This is like my favorite thing that happened to me all week. Hold on to this memory. You know, when days are really low and bad, I want to remember how delicious this is feeling, because the world is full of positive, beautiful moments, even if you're not feeling them at this particular time. So remember this moment. And now I still remember this moment. It's been almost 10 years. Or at the time, my older son taught my younger son the lyrics to an old rap song, and I came home from chemo, you know, feeling really sort of deflated, and Isaac ran up to me and sang, I like big butts and I cannot lie. And it was just a great moment. So, you know, the people who took care of me, and the TV shows that we watched, when, right before my first chemo, the doctor asked if I feeling nervous. And I realized that not only was I not nervous, I was actually dying to get into the room, but it had nothing to do with the treatment and had nothing to do with my cancer. It was that my husband and I had started watching this crime show called The Shield. We were completely addicted. We had our DVD player, and I just wanted to start watching The Shield. That's all I cared about. And I really enjoyed that moment, that all I wanted to do was watch The Shield. I wasn't even thinking about cancer, even before chemo. And I really had a particular feeling of love for even just the actors who were there with me in the room. We ran out of The Shield and we started watching Arrested Development. And we were just laughing through chemo, and the nurses would come and see what these people could possibly be laughing about. So, and that was really a special thing for me. And it gave me an extra love for just people who exist in the universe, the people who worked on these shows. And it made me feel connected to way outside of the chemo room. It prodded me to, you know, really work on my book in a new way and publish it. And it changed my experience of lots of parts of my cancer. So when I was in the waiting room, rather than what I would normally have done, which is ruminate and be nervous, I was taking notes on everything around me, and, you know, what people were wearing, what the furniture looked like, and this was all material, and this was fun. I was really engaged in the moment. And I remember there was one woman who was dressed in very brightly colored clothes who was crocheting a pocketbook. It turns out she crochets pocketbooks. She made a sale. A woman in there was asking her what she did, and she asked for her card because she wanted one too. So, and I got to write all that down, and I sort of experienced these moments in a very positive way. It made me less fearful of non-health related issues. I sort of felt like, you know, when I was trying to find, say, agents or editors, and in my previous life, I would have been very uncomfortable cold calling new people. Now I didn't care. It wasn't cancer, so it was sort of you know, easier for me. And one aspect that was sort of different for me than for a lot of people was I actually liked the change in my body afterwards. I can't see sitting down, but I'm about 4'11", and I had D cups. And basically 75% of my body looked like it was made out of breast material. And I'd always been very ambivalent about them. And although my husband had said that he was first attracted by what he referred to as the magnificent rack years before, but I was actually looking forward to having something smaller. I went for B cups, which I still like. And I remember just before going under for the surgery, I had this kind of idea in my head that, well, maybe Rob was first attracted by the magnificent rack, but hopefully he married me for my ass, was the thing. But then I thought, you know what, that's a good line. I hope I remember it when I wake up. And obviously I did. So for me, it was very important. Really, part of dealing with all the negatives of my cancer was appreciating the positives. It gave me something to appreciate, and it didn't take away the negatives, but it just sort of took a little of the edge off for me. But one positive that I wanted to mention, that even though it's not my story, but it was so effective for me, is that I was on an online discussion group, breast cancer patients, and somebody started a thread of, well, what are the positive things that have happened as a result? Because we're always talking about all the nasty stuff. And it was a lot of some things that I've already been talking about, people from the church who would, take care of you and bring you food and watch your kids. And one woman talked about when she was a couple of weeks into her chemo, and her hair was just falling out in droves, and she was going to shave it that night, but she was very, very upset about how her colleagues were going to feel about it, and particularly the male colleagues. So she sort of inoculated them and said, "Listen, I'm going to look different tomorrow." So she went home and she did it, and she came in the next day, and her male colleagues had all shaved their heads in solidarity with her. And what a special moment that was. And it's moments like these that make you feel like, there really is still beauty in the world, even if, in your corner is filled with, kind of nasty stuff. So in general, I learned that for me, I couldn't control or tamp down my anxiety. I couldn't conquer it. I was nervous. I was scared. But what I could do was sort of live alongside it a little bit. And one thing that sort of came to mind for me as a metaphor for it was when I worked in the prison system, everybody had to pass qualifying exams for shooting. So I had to learn how to shoot. Not that I've ever, held a gun other than that, and if they ever had any need to give me a gun, then there were big problems going on to begin with. But, and not surprisingly, I was quite bad at it. But the first thing that I had to learn to do was to deal with the kick of the gun. When you shoot a gun, there's this very big kick, and it kind of knocks your arm off course. And no matter how hard I tried to steel myself against it, I just couldn't do it. My arm would just get knocked out, and it would be very, very hard for me to get my aim back for the next shot. And at some point I just decided to see what would happen if I didn't try to fight the kick, if I just let it go completely out of whack. And so I did, and it went totally behind my head. But I found that in one fluid movement, I was able to really bring it back and aim the next shot with no time lost at all. And I learned to just go with the flow of the kick. And that was sort of what I felt I was learning to do with my anxiety. I was just, thinking about it, accepting it, that it's there, but I could still do other things that I can enjoy. I could still, go on a bike ride. I could still nose kiss my kid. I could still do a lot of other things at the same time. But how did I kind of do that? So a lot of the issues that came up during my work and training were really sort of coming back to me in a more personal way, a way that I could use in my own life. I mean, the most important is actually the simple stuff. Good friends to listen and distract, good conversation. If you want to know more information, there are people who've been there and done that you can talk to. If you don't want to know more, you don't have to. One thing technically I found very helpful is relaxation breathing, which is a deep breathing. If you put your hands on your chest and your abdomen and you breathe in If the hand on your abdomen is being pushed out, that's deep breathing. Sometimes, particularly if I'm very anxious, just doing a few deep breaths is enough to sort of chill me out. Exercise is very, very important. Really, all of these things are not just good for people dealing with cancer, obviously. They're good for anybody. Exercise is particularly useful for mood, for your physical health, for healing. If you're constipated from all the meds that you're taking, it's actually very good for that too. And then things that are fun, things that appeal to you, art forms that appeal to you, and doing things that make you feel a sense of purpose. And we'll get to that more. One of the biggest coping factors is social supports. Your friends, your family, your coworkers, your neighbors, and learning how to have them be helpful. Sometimes people say things that are not so helpful, so you sort of navigate it. Now, I think people have sort of different styles, as I've been talking about, and I think of us as being sort of on what I call a reality continuum. Some of us really are realists. We want to know all the details. We want to know exactly what's what. And some of us are more kind of deniers of bad outcomes, sort of positive thinkers. We really need to think positive. And the thing to remember is, and I think we all sort of exist somewhere on this continuum between them. And the thing to remember is that neither one is particularly better than the other. What really has to happen is really need to kind of tolerate each other's differences in how we cope. Sometimes the realists think that the positive thinkers are, not processing reality, and the positive thinkers think the realists are too negative. But to really be able to help each other and to remember that we are our social supports are one of the most important ways that we help each other. We have to learn to sort of tolerate each other's differences that way. I have a positive thinking friend, and we just can have to kind of tolerate each other's style. And even I can appreciate that positive thinking can be very galvanizing force. There can be a downside if it doesn't come to you naturally and you're trying to sort of force yourself to do it, because negative feelings are going to pop up. And what can happen is you can get a sort of a double whammy. You get afraid about being afraid because you're not being positive enough. And it's important to say that there's really no evidence that negative feelings will hurt your survival. You can be anxious, you can be depressed, but if you're doing the things you need to do, there's no reason to be afraid, extra afraid that's getting in your way. And in particular, a psychologist named Julie Norham found that there's another sort of style that she called defensive pessimism. And that's sort of, I'm kind of a poster child for defensive pessimists. Those are people who kind of, they're anxious, they're worried, but the way that they cope is that they think about the bad potential outcomes, and they come up with a plan B for this problem and that problem and the other problem, but then they can relax. And what they found is that people like that, if you try to force them to do a sort of false optimism, that actually makes it harder for them to cope. But if you let them go through their kind of proactive problem solving, then they can sort of relax more. And it can't be stressed enough how useful humor is in very kind of serious ways. One way that really brought it home to me was Viktor Frankl, who was an Austrian psychiatrist who wrote Man's Search for Meaning, which was a big bestseller years ago. He talked about giving a patient of his homework assignment of finding something funny every day. And the thing that was particularly moving about that was that they were both inmates at Auschwitz at the time. And that's how important he felt that it was. And he felt they could find funny stories at Auschwitz. And I would think about that, as I felt that, well, if Frankl could find funny stories in Auschwitz, I could find funny stories now. And humor helps not just in psychological ways. It helps in physiological ways, too. So psychologically, it sort of gives you a distance, a respite, even if it's just for a few moments. But physiologically, laughing actually helps reduce stress hormones. It actually is associated with higher pain tolerance. In studies of people on pain meds, if they've been laughing at a funny movie, they actually need fewer pain meds or lower doses of pain meds afterwards. And subjects have sort of tolerated more pain and sort of experimental. So it's very useful. And the singer Marilyn May once told me about life in general that, if you don't have a sense of humor, you better latch onto someone who does. So even if you don't have a sense of humor, you can still find ways to laugh. Now, two kind of different attitudes that we taught back at the hospital really came back to me as well. And they were helpful in very different ways. And those were mindfulness and meaning. So now a lot of people have heard of mindfulness or mindfulness meditation. You can look at mindfulness in two ways. One is a very specific kind of approach, a meditative practice of mindfulness, and the other one is just sort of a mindful approach to life. A big misconception that people have about what mindfulness is they think that it means clearing the mind, but it actually doesn't. Mindfulness is really about focusing your awareness on the present moment and trying to live in the present moment as much as possible. The monk Thich Nhat Hanh, who wrote a book called The Miracle of Mindfulness that really sort of brought it to the world, he described it as not letting your life get sucked into the future, not forgetting to live in the moment that you're living in now. Now, mindfulness meditation, which is a very specific practice, is sort of all over the place. It was brought into Western medicine by a psychologist named Jon Kabat-Zinn, and a lot of people have found it very helpful for all sorts of things: blood pressure, depression, quality of life, even overeating. And there are lots of, you can just look it up on Google. There are apps, there are phone apps, but I'm not going to do that with you. That's something that is sort of easy to find afterwards. Another aspect of when I was learning how to shoot was that I learned that focusing on the target was actually not helpful. We needed to, in order to qualify, we needed to make 24 out of 36 shots in the middle circles on the target. And I got fewer than a third of them. And what I discovered was what I really needed to do was stop focusing on the target. I really needed to just line up the sights on the gun. If I could focus only on lining up the sights of the gun, if they were perfectly lined up, then the bullet went where I was aiming. And if I didn't have it perfectly lined up, it didn't matter how well I was looking at the target, the bullet went off. And I slowly learned to stop paying attention to the target, focus only on the sight. And on qualifying day, I made 35 out of 36 shots. Oh, wow. So it really made a difference. And again, this really sort of came up for me later in thinking about this mindfulness issue, where stop focusing on what happens with my treatment. Stop focusing on what will happen later. I need to live my life now. And I would feel like whatever happens to me, I'm not dying today or tomorrow, or at least not because of cancer. So I can live today and tomorrow. And if I have chemo coming up, I had 2 weeks between chemo. So the first week I was sick, and the second week I was fine. But the second week I just kept dreading the next chemo. But if I could just focus on that day, on this Monday, and this Tuesday, and this Wednesday, I could enjoy my days. And whatever crummy stuff will happen the next week is sort of, like Alvy Singer's mother said, like none of my business. I can sort of deal with it then. So for me, it was very helpful for kind of focusing on the present moment, which also sort of distracts you from your fears, but your fears can sort of be there at the same time that you can be doing these other things. So, but one thing I wanted to do, which was the first exercise that I ever did of mindfulness, involved Hersheys Kisses. So I have a whole bag of Hersheys Kisses for anyone who's here and anybody who wants. You take at least 2. Eat the first kiss exactly as you would eat a kiss. Then take the second one and try to experience it completely and totally in every way, with as many of your senses as possible. You can hear what happens to the paper when you unwrap it. You can feel the different texture of the foil and the label, different texture of, I won't eat it, but of the chocolate, the smell of the chocolate. And then you can put it in your mouth and just feel it melt and feel the different shapes, feel how they're rounded, feel the point melting. Focus only on these things until it finally sort of dissolves away. And think about the difference between those experiences. I'm not saying that's how you should always eat a Hershey's Kiss. Although if you tend to eat way too many kisses at once, that is actually a very good way of not eating too many kisses at once. But the idea is sort of as just sort of an example of what it means to just try to focus on only one thing and be able to not be focusing on other things. And if other things come into mind while you're doing the kiss, that's okay. There's no need to judge yourself and say, oh, damn, I'm not doing this right. Just bring yourself back to the kiss. And that's sort of a little microcosm of what kind of the sort of mindfulness experience is like. The next approach is meaning. And that, Frankl, he wrote a lot of books about this and how the time when he went to Auschwitz, he was a psychiatrist and he had a manuscript for a book about how he felt meaning was a central craving in human existence and that life is meaningful up until the last breath. And he had this rather sort of naive idea that he was going to hold on to this manuscript and when he gets out of here, he's going to publish this book. But of course, he couldn't hold on to anything, and he had to ditch the manuscript. And what he did was he said, well, I'm a psychiatrist, so I'm going to deal with this completely dehumanizing situation as a psychiatrist with a sort of observing eye on what the psychology of this process is, and what he did was he treated it like a lab for his ideas about meaning. Is my life still going to feel meaningful, as I go through this process? He did ultimately write that. That was not, Man's Search for Meaning was not the manuscript. He had another book called The Doctor and the Soul, which was that manuscript. And in particular, he comes back time and again to this quote from Nietzsche, which is, he who has a why to live for can bear with almost any how. The idea is if you have a larger meaning, something bigger that you're working for, you can tolerate a lot more that life throws at you. And that sort of meaning and crisis in this way, they have sort of a two-way relationship. So having this larger sense of meaning or purpose helps distract you from the crisis, or it may help you make an opportunity of the crisis. But crisis also often forces you to appreciate what's most meaningful in your life. It may force you to prioritize. You may learn that you appreciate things that you actually hadn't realized you appreciated, or learn that you really don't like some of the things you thought that you liked. And in general, the sense of meaning is really about feeling connected to the larger world, part of a larger whole, responsible to that world. You have unique goals and tasks to fulfill. Those goals and tasks could be in the immediate future, far in the future. You can have kind of different ones, and that having a sense of meaning can bring a sense of fulfillment and peace, regardless of what else is going on in your life. Now, Frankl felt that we have some freedom to choose our attitude towards our suffering, and that this was part of that choice. Can we make meaning out of the experience, or can we find meaning despite the experience? And there are various ways of experiencing a sense of meaning. It might be in your work. You might love your work and love doing it. You may have causes that you believe in that you can advocate for. And often people who go through various traumatic experiences become advocates to try to help other people who've gone through that experience, because it gives them sort of a meaning to that suffering, that at least I can use it to help somebody else. Creative pursuits like arts. the appreciation of beauty, appreciating something that you might not have appreciated earlier. Just a beautiful sunset could be a rose. It could be some stranger's smile on a day. Your relationships, and the very fact of how we deal with their suffering, that's unavoidable. Some people take great pride in various ways that they deal with their suffering. For me, the more meaningful my activities, the more engaged I was, and also the more distracted I was. So when I was in the waiting room, I wasn't thinking about chemo. I was thinking about, oh, look at that. Look at what she did with her dress, and look at what she did with her scarf, and I could sort of live with both at the same time. So there are some exercises. I don't want to spend a lot of time on it because there are a lot of people and there might be a lot of questions. But so what is this meaning thing? What you can try to do is think back on life, moments that felt particularly meaningful. It could be something that helped you get through a difficult day, or a time when you felt kind of particularly alive, my butterfly kiss, or my nose kiss, or the day when I made the 35 out of 36 shots. I actually still have that target from with the bullet holes, and I like looking at it. Sometimes it makes me feel kind of tough. And is there a pattern to the experiences that were meaningful? Might they still be meaningful? Might there be ways that you can do some of those things or recreate some of those experiences now? Or are different things meaningful that you might want to do something with? For me, as I said, I particularly love watching television, so I created a page on my webpage called Chemo-Worthy TV. And these are, just TV shows that are so fabulous that I would have enjoyed them even in the chemo room. So 2 of them I did enjoy in the chemo room, but there are lots, and this is just some of them. I have even more. So if you're ever looking for good television, you can always look up Chemo-Worthy TV and find and find a show. And I did this without apology. It seems this is not the kind of thing that psychologists usually spend their time doing. I didn't care. It meant something to me, and it doesn't matter if it doesn't mean something to somebody else. And the fact is, if it means something to someone else and they come and look at my page, I take great, I have a lot of gratitude for that. So, and one sort of simple exercise that we do is the IMA exercise. It's just IMA blank, and you just fill in the blank. And notice if there's a pattern to how you fill in the blank. And it could be adjectives, it could be activities you do. I am someone who likes to ski, which is not me. I've actually never skied, but I'm a tough chick from Brooklyn. I'm a sensitive gal, whatever it is, and those things help you sort of to focus on the things that are meaningful in life. So these are some of mine, and in general, it's sort of about integrating the past, the present, and the future, right? You're kind of learning who you are. What are your strengths, and what are your weaknesses, and what do you want to work on? What kind of, who have you been, and who do you want to be? And what are different goals that you might have that you could work towards? That they're there regardless of what's happening with cancer. And again, it's helpful to have goals that for at different points in time, so you can have longer-term goals and shorter-term goals. If all you have is one big longer-term goal, then you might not get a lot of satisfaction for quite a while until you get there. So and focusing on ways of helping others. It sounds altruistic, but it actually is very kind of helpful. It takes the pressure off of you. It takes the focus off of you, and it feels good. And there were days when I was just very cranky and unhappy, and I knew that I was just not going to be happy today. And I would say, you know what? You're not going to be happy. You can at least be useful. And whether it was cleaning up or doing a favor or checking in on a neighbor, it actually sort of got me off my butt. But also feeling helpful makes you feel happier and makes you feel better, and you might actually sort of get back into the swing of things sort of without even realizing it. So So that's pretty much it. I just want to mention some resources in case anybody wants to look further into any of this. For relaxation breathing, sort of the mother of all relaxation exercises was from Herbert Benson and the relaxation response. And for resources on mindfulness, there's the book by Thich Nhat Hanh that I mentioned. John Kabat-Zinn has many books, but there's one in particular, Full Catastrophe Living, Using the Wisdom of Your Body and Mind to Face Stress, Pain, and Illness, that people dealing with physical illness find very useful. And he also has guided mindfulness meditation tapes or CDs, audio CDs. And there are lots of apps for relaxation and mindfulness training. I happen to like one in particular, which is headspace.com, but I think it's really because the guy who does it is a former, I think, Buddhist priest named Andy Puttingham, has this really lovely English accent that's like, you know, like butter. I just like listening to it. So that's, you know, but you know, that's sort of a your mileage may vary kind of thing if you're interested. And also if you're looking for sort of psychotherapy referrals with specifically people who have experience with cancer issues, I'm sure there are lots of places. I'm sure Share has lots of possibilities, but also APOS, the American Psychosocial Oncology Society, they have a toll-free helpline, and they can help find somebody with cancer experience in your area. So that's about it, and I thanks a lot for letting me do this. This is actually part of my coping style, is using this very unpleasant experience to try to you know, be useful. So thank you.
Thank you so much for your time and your presentation. Are there any questions in the room? If not, I have a couple of questions that were submitted. Someone asked how having cancer affected your relationship with your patient.
Well, I guess I wasn't seeing patients anymore at the time, but what it did have an impact on is that the woman who was the chair of my department back when I was working at Memorial, she started a group specifically focusing on the needs of older patients with cancer. She herself is in her 80s, and she's my co-author on that book. We wrote a book about aging from the perspective of midlife and older age. She's 86, I'm 52. And I became a consultant to her team, and my personal experience with cancer really made me appreciate aging, you know, like I never had before. And when my friends were looking at their 50th birthdays, their feeling was, oh my God, and it's 50 and 60 and 70. And my feeling was, I'm really glad to be 50, and I hope to be 60 and, you know, 70 and 80 and, you know, bring it on. And I felt that there are probably more pleasant ways of getting a better attitude towards aging than getting cancer. But for me, it really did make me appreciate. That was one of the things that I really sort of appreciated in a new way. So I've been working with her and, you know, work together. And I think part of that was sort of directly an outcome of experiencing cancer, and sort of this kind of my wish that I get to age as much as possible.
How would you suggest dealing with feelings of anxiety and vulnerability caused by unanticipated gaps in treatment?
And those are because of medical issues?
Not clear.
Not clear. That's a tough one because I think it sort of very much depends on you. It sounds like that's a good time to try to be not focused on the treatment itself, you know, to be as focused on other things. If they are mindless distractions, that's good, but they could be mindful distractions too. Try to get engaged in other activities and sort of get a sense of what is it you like doing. You know, forget about that other stuff. That other stuff will happen as it happens. But what are the things that you like doing, and really try to focus on them in those moments, and kind of remember that you can worry about those issues, tomorrow or next week or next month, to try to really, that sounds like a good time for kind of either a mindful approach, or if you have some bigger thing that's important to you, focus on that bigger thing. And also remember to breathe, always a deep breathing, sometimes even just a few deep breaths at a time can help. And if your level of distress is so high or your level of functioning is sort of impaired, that might be a good time to get help with sort of trying to relax.
Anyone else here? What were the differences between your reactions to the first and second diagnosis of your cancer?
Well, that's very interesting because they were quite different for me. So the first time around, there were two things. One was I had this need to feel in control, and the way that I did it was two things. One is I wanted all information. Every chemo, I had a whole database on chemo side effects and potential and possible solutions, and they were like homemade solutions and science-based solutions, and I needed to know every possible thing that was that could go wrong, and all the stats and all of that. And in addition, I had this incredible need to talk about it. And it made me feel in control to talk about it. One exception was my son, the younger son, was starting kindergarten the same week that I started chemo. And I said to myself, you don't want to be known as the the cancer chick for the next 13 years in this school, so you don't have to tell people there. It's all I talked about. And every new person I met, I talked about it. I mentioned it. It just sort of came up. And I had to realize that I guess you do want to talk about it. And the thing is, I'm not the cancer chick. I mean, when people have scares and things, or people get diagnosed, they might come to me, but that's fine. I have lots of relationships with people that have nothing to do with cancer, and that was sort of the way that I felt like I was in control. I know people who were completely the opposite. The way they felt control was by not telling anybody. So it's really like I said, what makes you feel better, what makes you feel worse. The second time around, both of those things were quite different. I really did not want to talk about it. I just sort of wanted to do whatever I had to do and just sort of be done with it. I started looking up all sorts of stats, and then I thought, you know what, I don't want to know. If it happens, it happens. If it doesn't happen, it doesn't. And the really interesting thing was that as much as I'm sort of, this realist person who wants to know the facts, I even got into a little magical thinking bit for a while the second time around. I had this game that my mother-in-law showed me, which is called Bookworm. It's about these letters that fall to the ground, and you have to make words out of the letters, and there are these letters that are on fire, and if you can't figure out a word to use them in, they go down, and when they hit the bottom, my terminology would be, I died, That's how I always referred to it. So I had this notion in my head that if I can just not die in Bookworm, then my treatment's going to work fine. I knew this was completely magical thinking and completely irrational, and I also knew that I was taking a huge risk by thinking this, because what happened if I didn't make it in Bookworm. And I know of absolutely no evidence of any connection between how you do on Bookworm and how you do a cancer treatment. And I decided that all I had to do was make it as far as my mother-in-law. If I could beat her, I would be fine. And she had 10 million. 9 million was her highest score. And I did. I made it to 16 million, and I finally died, but it didn't mean anything to me. I felt like it's fine. It's the spell is broken, and Bookworm is not going to affect how I feel about my treatment. It didn't make any sense to me, but the fact was it made me feel better at the time. So until it made me feel worse, I wasn't looking a gift horse in the mouth. So sometimes things are different. I think that For a lot of people, the second time around is different just because you had the experience of the first time, whereas the first time you were sort of feeling your way around more. So but I know there's somebody here. Do you have a similar feeling or a different feeling?
It was really strange. The first time I went around, it was, I was in a fugue state. It was like stuff was happening, and it's like I remember sleepwalking through it.
Mm-hmm.
And then the second time around, it wasn't a recurrence. It was a whole second primary. Mm-hmm. And it was more, I had done a lot of work since then, and it was more, let's get down, let's do what I have to do. I had already taken the steps to scrape off the things that weren't helpful for me and really embrace the things that were, and that included people. That really included people. And I stopped being the good girl.
The second time?
The second time around. You know, the gift really kicked in, and people would complain to me about petty, what I felt were petty little annoyances. Mm-hmm. And I look at them like, this is it? This is the most you have to complain about in your life? Mm-hmm. Can't help you. Can't help you.
No.
Somebody else played bookworm during a treatment.
Oh.
What were your best motivators to keep going?
Well, it's funny because in a sense it was my kids, but I couldn't focus on them because of what I was describing earlier, where Emily Dickinson has this poem where she said, "Tell all the truth, but tell it slant. Don't hit it head on." And that's sort of how I felt a little bit about that, where I was focused on them, but not in this sort of big picture way. I was focused on their care. I was, focused on the older one, who was 10, but very ruminative. So lots of discussions about like mortality and issues like that. And it really sort of helped me when I had to think about, well, how can I say this to him in a straightforward, honest way that's not overwhelming? And it was much easier for me to sort of digest these thoughts for him than it would have been if I was just thinking about them on my own. So that really helped a lot. The book really made a big difference because I was really sort of, anything that happened, that was just more fodder for the book. And if something bad happened, I'd say, well, it's going in the book. And that sort of kind of transformed it. And even and since then, when I sort of want to think it's all in the past, but I can't know, that you have to check in 40 years and find out if it was really all in the past. I try to remember, at the time when I was actually having a much harder time, I still managed to ride my bike sometimes. I still managed to, enjoy lunch. And if I was able to do it then, I'm able to do it now. In the same way I felt like, if Sarah could do that, I could find my way too. So, and I think one of the important things is, especially if you're having a very hard time, is remembering to have the faith that you will find your way, even if you're not finding it right now or you're not finding it today. It makes it easier to sort of tolerate, and also to put it into sort of a meaningful context, like, okay, this bad thing's happening to me now. What am I going to learn from it, and how am I going to, use it, and how am I going to make use of it? I had lots of fun playing the cancer card when, when I was sick. And I used it very liberally. Mm-hmm. And I'd rather not have been in a position to play the cancer card. But hey, if it was going to help me get what I want, I'm going to make this sucker, work for me the best way that I could. And I found that all of these things were actually coping mechanisms for really kind of just sort of moving forward, and then trying to remember to enjoy the moment. It's sort of like this balancing act between, working towards some kind of future goals and just enjoying the moment that's right here in front of you. I think sort of along those lines.
Any other questions in the room? We've come to the end of our questions that were submitted. If anybody wants to submit them, do so now, please.
I just think a lot of what you're saying is not just a cancer, because balancing life
Absolutely.
in the future and now is just life.
I agree.
And, cancer, as you say, focuses it seriously and the immediate, but really the balance of, how do you manage that anxiety that this will happen in the future?
Right.
Enjoy the moment today.
Right.
Not, through all my effort.
Yeah. And Paul Cowan, the journalist, he used to divide the world into two groups of people: the sick and the not yet sick. and that basically we were all dealing with the same thing, but the sick were more aware of the things that we were dealing with, and the not yet sick sort of had this luxury of not being as aware. Now, there's some people who are not yet sick who are very anxious, who are worried, who are always afraid of some bad thing. That would have, start worrying, details to follow, kind of thing. But I do think that a lot of the things that really help people dealing with cancer issues are the things that help people in sort of all walks of life. It helped Viktor Frankl in dealing with Auschwitz, and he, in fact, would give talks in prisons. His prisoners were a very big part of the group of people who were writing letters to him. So a lot of the issues that one deals with in cancer are really just kind of much more intense versions of issues that the people are sort of dealing with in life in general.
I have a question.
Sure. Oh, hi.
It was interesting to listen to your suggestions on your talk. Very helpful ideas. And I find myself, had 2 breast cancers, and my second one was in 2. So I'm coming up on my 4th year for my second breast cancer. Like this one over here, I had a completely other breast cancer, so which really threw me quite a lot. And I was listening to your thinking that I'm really receptive to what you're saying now, but I don't know that I would have been as receptive to that. What is almost 4 years ago. I'm still coping. So I just wonder if you have any thoughts on how the tactics you used early on versus what you use now that I can't remember what you said you had your last was in 11?
Oh, yeah, 11.
So it's like about quite a few years out. So I'm still experiencing. In fact, when you were saying something, I had forgotten some of my experiences just as you were going through them, was refreshing my mind, and I'm thinking, oh, I remember that, I remember that. I remember those things, and it was actually making me feel very good to hear what you said. It was very helpful for me now. And I thought, I wonder if I'd have been able to hear that and been as helped by it to use earlier as I am being helped by it tonight. Now, I don't know if anybody else has had that.
And it might be. I mean, part of what's happening in the very beginning, you mean like in the beginning part?
In the early stages, I don't think I could have, I'm not sure I could have even heard what you just
said.
Yeah, I was in such a shock about it.
What happens in the early stages is that you have sort of no idea what's coming, and in the really early stages you don't even know how bad it is, because you know you have cancer, but you don't have your pathology, you don't know what your treatment's going to be, so you just have this kind of big bad thing just happen, but you don't even have anything to sort of hang your hat on in terms of, well, how am I going to cope with this? And for a lot of people, just getting the detail, helps them to just figure out, okay, this is what we're dealing with now, and then they can figure out how they're going to cope. So for a lot of people, the very beginning part is sort of a big mishmash because they don't quite know what they're dealing with yet, and also there's still sort of the shock. And I don't know, it's possible that nothing would help in the very early stages. Not that nothing would help, but that there's nothing that you can count on to help. You might stumble onto something that would help. I remember when I was first diagnosed, I was not sleeping at all. I just was not getting a lick of sleep. And I tried to do this mindfulness stuff. I did not want to do it. I was not into it. And in fact, it caused me stress just to find, a place and time to do it, which I actually hear from a lot of people. And I called an old supervisor of mine from Memorial, and I said, I think I need meds. Just tell me, I don't want to go anybody I know from the old department. Give me a name for, somebody in the community. And he said, well, here, I'm going to give you a couple of names, but here's the thing. It's kind of your job to be really anxious right now. If you can bear it for, say, a week or two, you might find that it levels off and you're fine. If you can't bear it, call one of these people. And I decided I can bear it. But in 1 week, I'm going to check again. I'm not waiting the full 2 weeks. And a week later, I was actually doing much better. And if I hadn't been, I would have called one of the people. But one thing that really helped me was just his saying that it's kind of your job to be anxious right now. And so, you know, in general, you know, when we recommend treatment, it's about two specific things: your distress level and your functioning. You know, everybody gets upset about things in life. Everybody gets depressed about things in life. The question is, how much distress are you in, and what's it doing to your functioning? If you're in a very high level of distress, or you're in a high level for, you know, too many days, or your work or your schoolwork or your relationships are really being hurt by whatever is going on, that's a good sign that you really want to kind of actively do something about this. So, and during that time, I don't know that any particular thing really helped me. It was more just sort of getting used to this new level of normal. And really the most helpful thing is just, you know, kind people and kind words, and and things that would come out of the blue. So I told my neighbors, and I thought this elderly neighbor of mine who I call Sonia in the book, and I very tearfully said, "Sonia, I have breast cancer." And without missing a beat, she said, "So who doesn't?" Now, if you had told me somebody said that to you, I would have thought, what a horrible thing to say. In fact, it was my favorite thing. It perked me right up. It really made my day. It just made me feel like, you know, I'm part of a whole community here. I'm not alone. And look, I may come out the other side. But I would never tell somebody, go tell your friends, so who doesn't? You know, when it just so happens that it worked, you know, for me. And I did, you know, when I started doing mindfulness was way after the actual cancer experience. I did it once, actually, and I didn't even make it through the whole session. I made it through about 10, 15 minutes of the session. It really, really worked for me. It really calmed me down, but I had no desire to do it again. I started doing it just about this past year was when I started doing it again. So my feeling is that one should be fluid about these things. As something happens that makes you feel better, that's a keeper, you know. Another thing that happened, well, one thing that was very useful for me was I had back problems, and I was seeing a physical therapist at the time when I started chemo. And she's very much a power positive thinking person, and she was always saying that, you know, I really needed to have a more sort of positive, I needed a positive mantra, and I needed to have a more uplifting, you know, way of talking. And I was really, really cranky one day, and I had this thought that came into my mind, you know what? You get what you get, and that's what you get. And it actually calmed me down. And the next time I was feeling very upset, I did it again. I said, you get what you get, and that's what you get. And it calmed me down again. So I came in the next time. I said, I have that mantra. It wasn't what she had in mind, but it did the job. You know, it was my mantra, and it worked for me. And that's why I can't really give a kind of a specific, try this or try that. That might help. There might be very particular things that might be helpful. So like CBT, cognitive behavioral therapy, is a very, very sort of focused kind of homework-giving therapy. You might, you know, somebody might be in a mode for doing something like that, not be in the mode for doing something like, you know, mindfulness or whatever. One thing that I would always say is at physical exercise, force yourself even if you can't stand it. I can't stand it. That can really be very, very helpful for, you know, every aspect of functioning, and also just sort of find your way. And it's painful to find your way, but that people do it sooner or later.
You addressed this question, but in case you have anything to add, can you talk about how to be more mindful? The fear and anxiety seem to always creep in, and it's difficult to keep it at bay.
Yeah, that's, well, you know, one of the things is to actually try mindfulness, the meditative practice. I mean, in general, you want to sort of do it when you're not in crisis, because it's sort of like a muscle that you develop over time. It's easier to take it in, but one can try it at any time. You can use one of those apps. You can check out Jon Kabat-Zinn's, and that's really a way of kind of training you to focus on the present moment. That's what can be very useful about it. And being mindful, being aware of the things that really matter to you and focusing on them, doing those things. You were talking about sort of, getting rid of the stuff or the people or the thoughts that aren't helpful. The more aware you are of what those are, because when you're in, say you're with someone who really is making you feel very unhappy, you don't want to be in the moment with that person. In fact, you're probably thinking about all sorts of other things to try to make this more tolerable. You want to fill your days to the extent possible with the things that are either meaningful to you, that are things for you to work toward, or things that you sort of enjoy. So the more you can do that, the more you want to be, mindful. But there are even sort of just practice things like the Hersheys Kiss thing, or one thing Thich Nhat Hanh talks about is washing your hands under the faucet, being really aware of the water and trying and not thinking about other things. And when you do think about other things, just bring yourself back to feeling the water on your hands. These are ways of trying to train yourself to kind of focus on the present moment.
Another thing that you addressed, but this question more specifically, is how much information did you discuss with your children about your cancer?
That's a very good question, because my kids are two different ages. One was 5 and one was 10, and they were also different kinds of kids. So the 10-year-old, he'd been talking about death since the age of 3, when his salamander died. And he very quickly realized that, oh, people die, I'm going to die one day. And the younger one, to him, it was like having a bad cold. He knew I had some kind of boo-boo. So we told them both together initially. And then there's another side issue that comes up, which is this, that people often don't think about. And that's once you've told your kid, well, your kid often talks to other kids, and they may get all sorts of information back that you really didn't, plan on them getting. And it might not be very good information. It might be completely stupid, information. So that's sort of a secondary issue. So we started out with what could we say that was straightforward and honest for both kids. And one of the other issues for my older son is that he can smell it a mile away. If you're trying to come up with the right way to say something, then he knows something really bad's going on, that you need to work so hard. So we had to not be too anxious about it. We had to just sort of go with the flow. So the information that we gave them was that I have this illness. It's a treatable illness, and the doctors are going to treat it. And one of the most important things was, for a while, I'm going to seem really kind of sick. But the thing is, that's actually not from the sickness. That's from the treatment. And the reason that's important is the kid sees you being sick, and then he thinks that's it. So if he understands that how you look and seem is from the treatment, that's actually a good sign to him. That's a sign that the treatment is doing what it needs to do. I called it a boo-boo for the little one, but a sickness for the older one. But the most important part of telling your kids is, what one of my supervisors used to say: doesn't matter what you say. What matters is what you say next. So, what then happens? What kind of questions does your kid ask? So my older son, he was very, very uncomfortable around me for quite a while. And I finally got out of him what the problem was. He was afraid that I was contagious. And he felt very guilty that he should be thinking about himself at a time when he knew that I was, was sick. And so I was, I thought able to allay his fears, because I could say, well, actually, I'm not at all contagious. But he said, not even a little bit? And I said, not even a little bit. He said, I don't mean to be gross, but if you cut off your breast and you rubbed the cells inside the breast on my arm, are you telling me I still wouldn't catch it. And I said, I can absolutely tell you, you still wouldn't catch it. And yes, that's very, very gross. And he relaxed. And so he was no longer, A, afraid of catching something from me, and B, he was no longer feeling guilty about thinking about himself. So that's why it's very, very helpful to talk to kids, because they pick up all sorts of things, and they, the way I can come up with things that are much worse than reality, they can really come up with things that are worse than reality. And in particular, they can blame themselves. So one of the very important things is, being just sort of alert to if they seem to be asking if they caused anything, because you can absolutely allay their, you had a fight, they were, spoke not nicely to you one day. So that's, one of the things to be kind of, talking to your kids is only half the deal. It's listening to them. That's, and if you really listen to them, that gives you sort of a sense of, well, what you would say next. And, for the little one, he would just say, how are you doing? And I would just say, I'm doing okay. Or some days I'd say, not so well today, the medicine is, was a little harsh. And they were fine. The older one, he, over time, we had lots more philosophical conversations about things like death, and I had to be open to talking to him about them, because if I wasn't, then he would just go underground, and I wouldn't have any way of sort of helping him through it. So you based on what you know of your kids, you get a sense ahead of time of what's enough information, what's too much information, and then be ready for the questions, and give yourself a break if you feel like you're not going to do a good job of it, because you'll probably be doing a fine enough job of it. So it's complicated. Yeah. Mm-hmm.
Any other questions in the room? Okay. Oh, sorry, one more. Nope, sorry, false alarm. Everybody just says wonderful, thank you.
Thank you. By the way, there are the two pictures.
Okay, we have one more thing to tell the people about.
Oh, my book is, here, I'll actually show it to you. It's called The House on Crash Corner and Other Unavoidable Calamities. This is the book. That's right, I've never showed you the book, so it actually exists.
Mindy Greenstein, right?
Correct, right.
Stein.
Right. Well, actually, as I was saying, I grew up saying Steen, but now I say Stein. And anything in the old country, it was Stein. So it was. So it's really any of the above.
It was a pleasure.
Oh, thank you very much. Right. Oh, and don't forget, if you want Hersheys Kisses, take at least 2.
So on behalf of all the people in the room with Dr. Greenstein and her Hersheys Kisses, and all of you out in Cyberland who are going out to get your Hersheys Kisses now, we'd like to thank the doctor for her excellent, wonderful presentation, and thank you all for participating. Please take the time to complete our short survey and let us know how we're doing. It should pop up on your screen right after this program. And don't forget to visit us at our website, www.sharecancersupport.org. A recording of this webinar will be available online, and you will be notified when it is ready to be heard or viewed.
Thank you.